This is TWiT.
Let's talk about the Google and Apple initiative, because I think that's very interesting. But I'm going to preface that with some information from an actual security expert, our own Steve Gibson, who spent some time on the show yesterday talking about this. And
Rule 6. If you're going to do a story on security, talk to Steve Gibson.
Yeah, at least get a Steve Gibson's take on it. A very interesting idea. So just the reason why Apple and Google are doing this. Well, first of all, and I think Steve said this, and I agree with him, it's nice to see, or maybe it was somebody on TWiT, but it was nice to see tech companies, more than giving money, writing a check, helping journalism, do something actually within their sphere of ability and skill.
Use their magic for good.
Yeah. So as everybody knows, Google and Apple have a considerable location information. Your iPhone and your Android phone both could be used as trackers, but there are huge privacy concerns doing that. So Google and Apple, also having lots of experience with protecting privacy and security, got together and created an API, an application programming interface, that could be used by apps from health authorities to help in this post-shelter-in-place world where it's very important, once you've detected somebody has COVID-19, to trace their contacts so they can all be quarantined. Contact tracing, this is called. It's part of a containment strategy. So they proposed a method to preserve privacy but still have this work automatically. It's, first of all, they propose it to be opt-in. Now, of course, once they've created this API, there's no way they can insist on it being opt-in.
That's not true, actually. They can control who has access to the API once they create it, especially because it's at the OS level that they're going to be doing this.
That's true.
So they could say to developers, if you are not a health, I don't know if they will, but they could actually say, yeah, you don't have access to this API. Sorry,
that's a good point. Yeah, so they're going to push out next month to all Android phones. Google's going to do that through the Google Play Store, and it will be automatic, and you won't have a choice about that.
It will be through Play Services?
Play Services, I mean. That's right.
Sorry, Leo.
No, good correction. No, good correction.
No.
You have Play Services because you have the Play Store on there. The point being, it's not an app download. It's going to just be pushed out as part of services. It'll be a new service, in effect.
And you talked briefly about location, but this doesn't actually use location. And that's what makes it privacy protecting. Right. It uses Bluetooth.
Right. And
it's basically using the Bluetooth network to ascribe tokens to people. They're not linking it to the location information.
Right. Although that is a point of contention, which we'll get to in a second. Apple will also be pushing it out mid-May, to their iPhones. And then presumably somebody can write an application. Both Apple and Google say eventually they will write an application. The way it works, each device, your device, will every morning in the beginning of the day create a token that is uniquely identifiable to your device. And then every 10 minutes, every 15, actually what it really technically is between every 10 and 20 minutes, it's roughly 15 minutes, it will generate an additional token using Bluetooth LE. When you come near another device running this API, which is presumably every smartphone, you will exchange these tokens. So that person will have your token, which has in it, built into it, effectively, the time of day that you guys were within 30 feet of each other. If you test positive, at that point, you push a button on the phone, or maybe more likely to prevent pranking, after you get the test, you'll get a QR code you'll scan on the phone or something of that nature.
Okay, thank you.
That's important because they don't want people just to say, yeah, I'm positive. So you'll have some verified way with a health provider to say, I'm positive. Then your phone will take all of the identifiers of the people you've run into over the last, I don't know what the period of time is, but something like
14 days.
14 days? That long?
I believe so, yes.
It needs to be. You could be symptomatic. You could be
asymptomatic.
Contagious.
Okay. So 14 days.
Asymptomatic and pre-symptomatic.
Yeah. So for whatever period of time you were contagious prior to your test, and those tokens will then be used to send a ping to all of those people's phones saying, You, without any names, no names, you ran into somebody who's COVID positive, you need to quarantine.
And you won't know when and you won't know where.
Right.
You'll just know that you passed. There's another angle to this too, and Stacey, that I remember reading, but I didn't understand. Your own token changes at some regular rate, right?
Yes, your token changes. Everybody's token changes every
10 to 20 minutes.
Day? Is it 10 to 20 minutes?
Well, you have two tokens. So you have your daily token, which is daily, 24 hours, and you have a 10 to 15 minute token. That token is important that change, because that's how you know you ran into somebody, because you got to have those tokens match so that you go, oh yeah, that's the person I was talking to at that time of day.
Right.
Yeah, 14 days. It says so right there. You got it. 14-day temporary store. So a number of people, including Moxie, Marlinspike, have raised issues, some of which have been, like the prank issue that we just talked about, have been shot down by Apple in subsequent white papers. There is some concern that this system could be used by ad tech, that it could be, surreptitiously, that there might have to be some personally identifiable information at some point exchanged.
One of the issues that this has is when you test positive and you say that, you have to put a lock on that token. So then you are now linking your magical token, basically, that no one knows is associated with you, with all of these other tokens. So it's theoretical that you could go back and figure out who that person is.
So it's tied to, and this is, Moxie mentions this, so does Steve Gibson. Already, the MAC address of your device is rotated every 15 minutes on your phone, or I don't know what the time period is, roughly every hour or whatever. It's rotated on your phone to avoid precisely this tracking. If you had the same MAC address broadcast via Bluetooth LE, then stores would say, oh, here comes Leo. But he can't, because it's not the same MAC address every time.
Oh, I didn't know that.
So I will say, I didn't know that either.
Apple pioneered that. Yeah, I think it's a really good technique.
I think actually the bigger danger is not hacking or even ad tech, but it's people twofold. One, for this to be useful, lots of people have to use it. Even in Singapore,
it's voluntary.
The people using the people using the contact tracing app is not super high. I think it was less than 20%, and that's Singapore. But also, right now, the way it's engineered, and they could fix this, because it is using RSSI, so signal strength, or because, it's just using a binary on-off as opposed to something like RSSI. What happens is you don't actually know, like, if I passed within 30 feet of someone, I'm probably not.
There's a lot of false positives. No, there's a lot of false positives.
Now, you could fix that, because with signal strength, you can say, I spent 30 minutes in the same vicinity, like 30 feet away. And I could even say as simple as I was 5 feet away from someone who's COVID positive.
So Scooter X says it is using RSSI, which is
but they're not putting that into any sort of score that helps you understand. Like, I mean, I guess, yes, that's how you would track, is using RSSI. But Stacey, it's not.
One of Steve's points was that you can presume Apple and Google have thought of all of the things that you and I are going to think of and have built that into the spec. But, who knows?
But some of those things are hard, like calculating. So, yes, calculating how long someone's been there plus how close they were, that takes a little bit of computing power. I mean, that's the kind of stuff that's happening on your phone all the time, and that's why your cellular modem eats up power.
Well, let's not promote that, because I don't want people to have any reason not to put it on their phone.
Well, that's the trade-off, is the more accurate you make this, the more battery consumption it's probably going to consume.
Let's not promote that, because I don't want to give people any reason not to do this.
And I had a little fit with Ali Velshi, who I consider a friend, because he did the usual tech and brings on the privacy police. And but I don't have Bluetooth on my phone because out of privacy. And I said, come on, man, priorities. But Stacey, to answer your to add to your question,
scan results. I'm reading the white paper. From Apple. Scan results shall be time-stamped and RSSI captured per advertisement. So they are going to use signal strength to otherwise you get way too many false positives.
Scroll up.
Scanning interval in Windows shall have
Okay.
sufficient coverage to discover nearby contact detection service advertisers within 5 minutes.
Okay.
It doesn't say anything about distance so far.
Yeah, and it doesn't say they're using that data to actually tell someone. They're not saying how they use that data. They're just saying they use it. So I don't.
Well, they might later on. This is one part
So
of it.
I added something to the chat that kind of addresses too, that part of the issue here is one of the big fights in the science world, which I only observed, I'm not a scientist, I don't know, is aerosolization. Is this germ aerosolized? That is to say, snot has gravity. It's heavy. It goes only so far and it goes down. Aerosolization is it's still light and it can travel farther, longer, and stay in the air. And you can, which means you don't necessarily have to have been near someone for a long time. They could have moved on. And interestingly, this paper I just put up in the chat that was linked to by Eric Topol, who's one of the people I trust, a physician and author, says that talking can be as bad as coughing, and volume of speech can make it worse. So people like me who are loud are more dangerous.
Well, also, and I've heard this also, that if you spend 10 minutes sitting across from somebody talking, that is much more of a problem than if you walk by them. And I don't know what provenance is built into this system. I'm sure it is, but I don't know what it is that would determine length of time that you're contacted, not just distance, but how long you spent with this person. All of that's
they're just trying to increase.
relevant.
It's the same as my wife going to the store. We've decreased our contact with other people hugely, but all it takes is one.
Right.
So just you have fewer ones, and in this case, certain number of people aren't going to use this, and it's going to be false in some cases.
So this
if
is
it
an
reduces some cases, does it increase?
You want to get your R naught down. If you get the R naught
zero
down below 1, it doesn't have to be perfect. It has to be below 1 to eliminate the virus. As long as
that's the goal.
Each person is infecting 1 or fewer people, you don't have the geometric growth that we have right now that's problematic. So
in my stupid way to put it, it's like fuzzy logic. You're close enough, right? You may not be exact. You don't need to be exact.
In other words, if it's good, that's good. It doesn't have to be perfect. So Steve's basic point was, having read all the white papers and digested all the information, that he feels this is a very good system.
Yay.
And it's effective and it is sufficiently private. And that's what I would expect from both Google and Apple, is something like that. There is this issue of if it's voluntary. Now, it doesn't, honestly, it doesn't have to be voluntary. If the government decides to put out an app and say you must download it and use it, and if, we see your phone doesn't have it, we're going to have the right to check it. There's nothing to say that can't happen. So just because Google and Apple say it's voluntary doesn't mean it will always be voluntary.
And let me understand something else.
But also, I want to say one more thing. I think people will do it. Look at it's not 100%, but look how much compliance you're getting right now in an extremely painful way.
Yeah, but you know what, Leo? Here you got a couple of things working, right? You got anti-tech and anti-big company, and privacy fetishism and moral panic.
No, I don't think so.
Having an influence. Well,
I think people will
you're going to have some number of people.
Sure.
For God's sakes, people who won't vaccinate their children against disease.
You have people going to parties, of course.
In church.
But I do think it will be harder to get people to adopt this than to adopt social distancing, because you find it. Yes, because social distancing.
It's easier to say no.
Well, there's an element of shame in social policing associated with this, whereas no one knows if you have an app on your phone.
We don't know. We'll see. It's going to happen. They're going to put this out. They're going to put out an app. I don't know if health officials will embrace this or not. But
are they putting out an app, or are they waiting for health?
That was my question. Yeah, where are the apps themselves coming from?
The apps are supposed to come from health, public health agencies, or
initially,
possibly hospitals.
Initially, unless I misread, Apple says
why wouldn't
later
Apple
this year
put out a universal app?
Well, because I don't actually want Google and Apple to have this.
Let me finish reading this. Okay. Later this year, iOS and Android. So starting in mid-May, the API be out. Apps can use it. Those apps coming from presumably health authorities, not Apple and Google. Later this year, don't know when that is, iOS and Android will receive updates that will let users opt into contact tracing without installing an app.
Okay.
So if there's going to be an app, that would have to come from health officials, but you won't need an app at some point later this year. We don't know when that is.
And the data from this that Google and Apple get, are they going to keep it? Are they going to donate it? Are they going to delete it? What's the policy there? Because that's another important question.
Their point is there's no personally identifiable information in the data. The system is set up so that your name,
I understand.
None of that is attached. So what if Google and Apple get it?
I don't, because if they have that data tied with my location.
But they don't know it's your location. They get a bunch.
But they have
a bunch
the MAC
of
address of the
identifiers.
phone, right?
It's not built into that. No, it's not built into that. No. They're, in theory, and Moxie Marlinspike was concerned about this, but Steve said, no, I don't think so. In theory, there is no PII associated in any way with either that daily number or the rolling number.
Stacey, they did vow that they would use this data for nothing else. Now, is there an audit of that? Is there, I'm sure Congress.
Well, I'm just thinking about like Verily, which they launched their like COVID testing tracker thing through Verily, and they did not have a privacy policy that precluded that data being used by Google for other things.
I
thought they did. They've added it though. I think they said to Congress that they were not going to use it.
Right.
And they argued, I think, properly that they had to use Google sign-in because they wanted to be sure of the identities that they were working with.
Yeah.
No, I think there's a good point there. Because there's also liability. At some point,
I think this is intentionally designed so that there is no information that they could use. What Moxie said, what his concern was that there could some kind of retro matching could be used, or this technology could be used illicitly by ad tech. But this isn't, I think, very consciously being designed because of that objection, not to have any PII in the actual numbers.
So what's fun about this then is, by gosh, we could do a lot more privacy-focused app designs.
Absolutely. And I think Apple does do that. They have something they call differential privacy, which in theory, although there's some debate over this as well, ensures the privacy. So there is some question about how widespread this use would be. I'm going to go on record saying I think it'll be very widespread. I think you'll be surprised.
I hope it will be. But here's another question. Could you imagine? So I have the app. I want to brag about the app. I want to push the app. I want to say, look at me, folks. I got the app. I'm a good guy, right? What do I do? Start walking around with my phone like this with the app up? Do I get a little Bluetooth badge that only works with it if it says, yes, he has the app? I mean, what can we imagine that would say, yep, Jarvis is a good guy. He's got the app.
Yeah. I think there'll be some peer pressure.
Could you write an app that points out?
You can change your Twitter avatar to I got the app.
I think there'll be things
Could you do an app that beeps at you if you're around people who have phones and Bluetooth on but don't have the app? No.
That's going to drive people nuts.
I know. I'm just being an asshole.
No, I'm like, I guess you could.
I honestly, maybe this is stupid of me, and certainly I'm glad that we would talk about the pros and cons. I don't want to push too many hypothetical privacy concerns around this because I think it's important that people do this.
I'm not worried about hypothetical privacy. I was mostly worried about hypothetical false positives and a false sense of security. And I mean,
that's up to the health officials to worry about.
Stacey, let's be clear here. This is merely an aid. We have to have human contact tracers, thousands of them. It is test, trace, isolate. Test, trace, isolate. This is not tracing. This merely adds in another layer.
It's not.
It is not contact tracing. Contact tracing
in theory, if everybody had a smartphone, it would be.
Even then, contact tracing properly done is going to be, I get it, and I tell the tracer where all I was the last 14 days and who I had contact with by name so they can be called.
I think that's going to be less accurate than the automated system in your phone.
It all adds up. It's all about reducing the load, trying to get as more of the people who've been exposed isolated to reduce the R naught, right?
Yeah.
And again, I'm no epidemiologist, but I'm reading a lot about this stuff. And that's what people were saying. It's not going to be a perfect system, but without human contact tracers who are trained to do this, this won't work.
Well,
this is not sufficient.
I wouldn't be willing to say
no
that
world
either.
is sufficient.
I wouldn't be willing to say that either.
Well, even though Apple and Google say this, they say this is not, the main lead at Apple says this is not sufficient. This is an aid.
Okay.
And listen to me. I'm the Mr. Tech optimist. Tech will not solve this. This requires human investment and human effort.
Well,
I
absolutely hope they do that, but
they have to. No, they're starting, right? Yeah. The smart governors, Massachusetts has started hiring contract tracers. New York is going to start hiring, and the East Coast cabal. And until you have sufficient testing at scale and contact tracing with reliability, and you isolate people who were exposed, there's no reopening. It's BS. Because the only thing that's different between now and a week ago is that my odds of being refused a ventilator went down. That's it. Everything else about what was going on is still there. Yeah. I can still get sick just as easily as I could last week, and I can still die just as easily as I did last week. And people have to take this very seriously.
Right.
Says an old guy who's vulnerable.
And contact tracing is being pursued in some countries now with some success.
Yes, that's where it works. Yeah.
Right.
South Korea and Taiwan.
So Leo, I agree. I don't want to hear BS privacy discussion. I don't want to hear battery discussion. I want to hear that this is a generous social act that you do as a responsible member of society.
Well, and I don't know about you guys. I won't speak for you guys, but
I understand.
I will run it the minute I can.
I will too. Eagerly and gladly, and I'll brag about it. And as Governor Cuomo, as President Cuomo, as I like to call him now, said today.
Do you really want President Cuomo?
Listen, as a New Yorker, as a New York City person, I'm trained to dislike him, but now we fell over. So as he said today in his briefing today, he required the mask. He said, "Listen, you come to a street corner and it's social pressure. You see somebody without a mask, you say, "Yo,
where's your mask?
What about the mask, buddy?"
Yeah, Paul Thurrott was talking.
A good New Yorker would.
Talking earlier on Windows Weekly, he had ordered a meal at a restaurant, went to the restaurant to pick it up, as one does to be safe, and nobody was wearing a mask. And he said, I saw red. I started yelling at him. They thought I was mad because the order was late or something. He said, "No, you're not wearing masks. I can't eat food if you're not going to wear masks."